the introduction that you've just heard, you were told that I would be an ambassador to the United Kingdom and was also accredited to other countries in Europe and in the Middle East, namely Egypt, Israel, the Holy See, West Germany, and the Netherlands. So, in that capacity, I served as ambassador to the Christians, to the Muslims, and to the Jews. Now, that's not too bad an achievement for one of the descendants of the most ferocious cannibals of the Pacific. Honorable Ministers of Health of the Pacific Island countries and heads of delegations. The World Health Organization Regional Director for the Western Pacific, Dr. Shin Yong-soo. The Director General, Secretariat of the Pacific Community, Dr. Colin Tukuitonga. Your Excellencies, the Ambassadors and High Commissioners, development partners and agencies, distinguished guests, ladies and gentlemen. Good morning, Nisam Bulavinaka, Salam Alaikum, Namaste. It was indeed a pleasure meeting some of you at dinner last evening. This morning, I wish to extend to all of you a very warm welcome on behalf of the government and the people of Fiji. I am indeed honored to join you to officiate at the opening of the 11th Pacific Health Ministers meeting. This year is certainly special for the health sector in the Pacific, as it marks 20 years since the inception of the first Pacific Health Ministers meeting. Interestingly, that inaugural meeting was held right here on Yanuca Island on the 9th and 10th of March 1995. We are therefore grateful that you have chosen to hold your symposium here this year. The Fijian government and the people of Fiji are honored and privileged to serve as your hosts. The Pacific health situation has gone through some exciting, challenging, and trying times since 1995. So this is an opportune time to reflect on what your predecessors had committed to way back then in 1995, the Yanuca Island Declaration, embracing the Healthy Islands vision. The declaration, in summary, embodied the collective concern and commitment of all Pacific Island countries to enhance the quality of life and continuing well-being of the Pacific people. Over the years, health ministers have met to reaffirm this commitment to the overarching objectives of the declaration. The meetings have been hosted by various countries, thus literally allowing the declaration to journey to and the vision of healthy islands to be embraced by most Pacific Island countries. The last meeting was held in Samoa in 2013. The vision of healthy islands, as defined 20 years ago, was for a place where, one, Children are nurtured in body and mind. 2, environments invite learning and leisure. 3, people work and age with dignity. 4, ecological balance is a source of pride. And 5, oceans are protected. I am advised and am most pleased to hear that this vision remains the principal goals in as far as the Pacific health sector is concerned. Honorable ministers and distinguished delegates, the world is undergoing transformation at an alarming pace. These changes, spurred on by information technology and improved transportation modes, span virtually every sphere of life, including social, economics, politics, religion, culture, and traditions, amongst others. It would be remiss of us not to discuss the reality that these changes have had and continue to have a significant and ongoing impacts on the Pacific. Many of you already know that developments have had mixed results in our health sector. In the recent years, we have seen significant investments in health, covering the constructions of hospitals and health and medical facilities, the training and recruitment of more medical personnel, and the ongoing efforts to produce affordable and up-to-date medicines. But on the whole, the health status of the Pacific people seems to have stagnated, if not regressed, in some places. The Director General of the Secretariat of the Pacific Community, Dr. Colin Tukuitonga, noted in a study of Pacific people in New Zealand in 2012 that the Pacific people had poor health outcomes due to high unemployment, low income, and overcrowding. They had high fertility rate owing to high teenage pregnancy, and they also had higher death rate and lower life expectancy. Furthermore, the Pacific people were affected by diseases including heart disease, a leading cause of death, diabetes, and cancer. The storyline is essentially the same across the Pacific Island countries. For example, as a longtime advocate on the elimination of HIV and AIDS, I have noticed the great need for the Pacific Island countries to address life-threatening diseases like HIV/AIDS, which has become one of the biggest development and socio-economic issues of our times. I also noticed that Pacific Island countries have a high level of non-communicable diseases in addition to various other social ills. The World Bank report in 2014 noted that NCDs account for about 75% of all deaths in the Pacific Islands. These include diabetes, heart failures, and obesity. Obesity is very much evident in most of our countries. In some, it is rampant. A good percentage of our population, including the youth, are obese. The cause, in most instances, is a combination of overeating, a popular Pacific pastime, and a lack of or not taking enough exercises to burn off the excess calories, another popular Pacific pastime. I won't go into the third popular Pacific pastime, but you can guess. As you are all only too aware, Overweight people tend to have less energy, are likely to become overheated and breathless during exercises. Their ankles are more likely to swell, and their joints in their backs and legs are more likely to ache. In addition, overweight and obese people are more vulnerable to high blood pressure, high blood cholesterol, gallstones, varicose veins, osteoarthritis, coronary heart disease, diabetes, stroke. The list is endless. What used to be rare occurrences 20 or so years ago, like amputations, are now sadly everyday occurrences. Let us be honest with each other. For some of our countries, this is a sorry state of affairs. In all these, the challenge must be taken on vigorously and led by governments in the region, as well as by civil society organizations and the private sector. We must work in unison and coordinate our efforts with development partners to help address the numerous health-related issues in the Pacific. We must also take advantage of regional and international forums covering the wide spectrum of issues in order to keep pace with solutions and proactive approaches. I have, for instance, attended many international conventions on HIV and AIDS at the Asia-Pacific level, including international conferences on AIDS around the world, and as recently as last July in Australia and in February this year in Thailand. I have often noticed that most Pacific Island countries were not represented at senior level. Hence, we miss out on the opportunity to meet one-on-one with leading scientists and health practitioners and discuss progresses in that field and consider further strategies to control the spread of HIV and AIDS. My point is that HIV and AIDS, like many NCDs, sexually transmitted diseases, teenage pregnancies, and so forth, are affecting the lives of a growing number of Pacific people, mainly our youth, the most sexually active, the bulk of our working and education population, and the most vulnerable. For us Pacific Islanders, this is ground reality. 2015 is the deadline for the Millennium Development Goals, the MDGs, which was set in the year 2000. For most of our countries, the achievement of the MDGs have been our aim for some time. I believe that all of us will achieve most of the MDGs. Whether we achieve MDG 6, which is to combat HIV/AIDS, malaria, and other diseases, is the big question. I hate to admit it, but sadly, for Fiji will not achieve MDG 6 in 2015. It is not for the want of trying. Our efforts in this has been Herculean. We have not got through to the changing of lifestyles. In other aspects of the HIV/AIDS advocacy, we have got through, but we have to get through in lifetime changes. Ladies and gentlemen, so this meeting is most apt and timely. I notice as well, ladies and gentlemen, that you have a full and exciting program over the next 3 days. But I wish to issue you with the challenge. As current leaders in the health sector, you are responsible for reflecting on what has been achieved in the past 20 years since the inception of the Yanuca Declaration. In the process of reviewing our progress, you must also help to shape and improve the health and well-being of all Pacific Islands people. This must be the single most critical outcome of your meeting. I have every confidence in you, in the same way that your respective heads of states and governments and all our Pacific peoples look up to you to reshape our health sector and ensure that we inch closer to achieving the noble objectives outlined in the Declaration. We owe this to our current and future generations. Additionally, I encourage all leaders at the local, national, and regional levels to take ownership of health-related issues in the Pacific. Leaders who ignore health issues would do so at the peril of their own people. Ladies and gentlemen, allow me at this point to express our collective gratitude to the World Health Organization for its foresight in establishing a union of Pacific health ministers 20 years ago. We also convey our appreciation to the Secretariat of the Pacific Community and to the regional partner agencies for their tremendous support in the implementation of the programs and activities derived from the Health Ministers' meeting. Furthermore, we thank our development partners, Australia, New Zealand, France, Japan, and the United States of America, for their assistance and technical support in these meetings and the associated programs targeted at achieving the Healthy Islands vision. We also acknowledge the increasing interest in the Pacific health sector from other nations like China, India, Korea, Cuba, Taiwan, and the United Arab Emirates, to name but a few. Thank you all for your keen interest in the development of the Pacific Island countries and the support for the improvement in health service delivery. Ladies and gentlemen, in conclusion, I wish you every success in your deliberation over the next 3 days, as we all look forward eagerly to the outcomes and to a more healthy Pacific now and well into the future. Thank you. Vinaka Bakalevu, Shukriya, Bahut, Dynavad.